Okay.
1496 degrees Fahrenheit. You're dispatched to a community pool for a possible drowning. Your closest community hospital is 10 minutes away. Trauma center is 45 minutes away by ground. Upon arrival, you find an adolescent lying on the side of the pool with a bystander holding manual C-spine control. Witnesses state that the teen was horseplaying and accidentally dove into the shallow end of the pool, striking his head on the bottom. He was immediately pulled from the water and EMS was called. The patient is awake and alert and answers questions appropriately.
Okay. Okay. Arriving on scene, I have my PPE. Scene safe.
Yep.
Okay. Because then I have one patient.
Yep.
Okay. I would call ALS and then I would consider C-spine. I would most likely use that. Okay. My general impression coming is they were alert. Okay. Hi there. You doing okay?
Yeah, it's hard for me to feel.
Yeah.
Yeah.
Okay. The general complaint is just can't feel things. Patient's airway is open and patent since he was just talking to me.
Yep.
His breathing looks regular with equal chest rise.
Slightly rapid, non-labored.
At this point, I'm also going to have my partner hold manual C-spine. Okay, I'm gonna listen to your lung sounds really quick. Gonna deep breath in through your nose and out through your mouth for me. Side. Lung sounds clear by the way.
Clear.
And then I'm gonna get your pulse, is that okay? Radial pulse is strong and normal.
No palpable radial pulse.
Okay, no radial pulse. Gonna feel for a carotid pulse.
It is rapid.
Skin is pink, warm, and dry.
Warm, pink, and wet. Below the upper abdominal quadrants. Pale, cool, and clammy above the upper abdominal quadrants.
You said, his carotid pulse was rapid, and then skin warm, pink, wet on the
Below the upper abdominal quadrants.
and then on the upper you said
Pale, cool, and clammy above the upper abdominal quadrants.
okay. Because of this, I think that the patient has a spinal injury, and his kind of located between his chest and his lower abdomen. I'm gonna treat for shock, apply a blanket. I'm gonna put an SpO2 on.
It is 94%.
Okay, 94. Okay, I'm going to apply a non-rebreather with 15 oxygen. Mask. Okay. And then I'm gonna check your pupils and close your eyes for me. Okay, open. Close. Open. Okay. One more time. Close. Open. Okay. Eyes are pearl. Or pupils are pearl.
Pupils are pearl.
Good. And then you said there is no major bleeding. I'm just double checking.
There's a laceration to the top of the head. Bleeding has mostly stopped.
Okay, it's mostly stopped. So, okay. This would be a rapid transport. I would put the patient on a long spine board and have a collar.
You don't have
Collar. Apply that before transporting. Okay, and then I'm going to get some vitals really quick. Okay, blood pressure. Well, I'll try a blood pressure, but he has no radial pulse. So. Blood pressure. What's the blood pressure?
84/48.
Okay. And then pulse is 64 and respiration is 12.
Carotid pulse is 130 and respirations are 26. Non-labored.
You said 26.
Yep.
Okay, and then do you have any experiencing any pain or nausea, dizziness, any sort of symptoms at all?
Just cannot feel or move his arms and legs.
And then do you have any allergies?
None.
Are you on any medications?
No.
Do you have any past pertinent medical history I should know about?
None.
When's the last time you ate or drank anything?
Barbecue chicken sandwich 45 minutes ago.
Okay. And then, what were you doing leading up to this?
Dove head first into the shallow end of the pool.
Okay. And then, I'm gonna go through my physical examination. Feeling the head, you said there was a laceration on the top.
Hematoma noted on top of head with minimal bleeding, yep.
Okay, I would apply a bandage to that, and then looking at the face, checking ears, eyes, nose, mouth, crepitus in the face.
No drainage from ears or nose.
Feeling the neck, checking C-spine, see if there's any step off at all.
No JVD, no tracheal shift.
Okay, no JVD, no tracheal midline. And then I'm gonna check his shoulders and his clavicle area. Any deformities at all noted?
No.
And then I'm gonna feel the chest, feel for any crepitus, movement, any pain.
No injury noted.
Okay. And then I'm gonna move to the abdomen, check on all quadrants. It is non-tender.
Non-tender.
Okay. Gonna check the pelvis. Pelvis is stable.
Stable.
Okay. Genitalia is unremarkable.
Priapism noted.
Okay. And then I'm gonna check the lower extremities, feel for any breakage, movement, pedal pulse.
Pulse absent.
Okay, no pedal pulse, can't move,
No.
the extremity. Okay, I'm gonna check the other one. Gonna see, is there a pulse on the other side?
Pulse absent.
Okay. I'm gonna check the upper extremities, feel for any deformities. There's no radial pulse.
Pulse absent.
Can't move hands at all.
No.
Check the other one. Same thing. No
No.
pulse.
No.
Okay. Then I'm going to roll the patient, check the back side. On the side. Gonna check the spine, any tenderness, shifts.
Unremarkable.
Okay. I would reassess this patient every 5 minutes. I guess before that, I would call the hospital. Okay. Calling the hospital, I have a middle. That's not the right one.
You have about a minute and a half left.
Got it. I have a male teen who's alert. He complains that he can't feel his extremities. He is on spine immobilization with rapid breathing. The upper extremity is pale, cool, clammy. Lower, warm, pink, wet. Noted spinal injury. He is hypotensive, slightly tachycardic. Has no known allergies or pertinent medical history. I would reassess this patient every 5 minutes. After reassessment, is there any changes in his vitals?
Respirations 28, blood pressure 84 over 46, SpO2 96% on oxygen.
Okay. Based on that, that is all that I would be able to do for this patient.
Is there anything you'd like to add, change, or delete?